Hello, my name is Arman. I'm going to be taking care of you today and doing a full head-to-toe assessment. What is your name?
My name is Cheyenne.
Good. And is it okay if I do this assessment on you?
Yes, it is.
Very good. So I already closed the curtain for privacy and washed my hands. Before we get started, this is a lengthy exam. Do you have to use the restroom to empty your bladder?
I do not.
No? Very good. Okay. So first, I'm going to be checking, doing a general survey of the patient's appearance. So he is clean clothes, good hygiene, and well dressed. His behavior is appropriate for the situation. He's nice and calm and relaxed. His body structure is symmetrical. He's sitting upright, not swaying back and forth. And I saw the patient walk in, so his mobility is also intact, and he did that without any difficulty. Okay. Next, I'm going to ask you some. The patient is alert, so his level of consciousness is alert. His speech is also clear and coherent, and I'm going to ask you some silly questions. Can you tell me your full name?
My name is Cheyenne Zamani.
Excellent. And what day is it?
Today is April 23rd,
And the year?
2025.
And where are we?
We're in Westlake Village.
Good. So the patient is ANO times 4, so he is oriented. Now I'm going to check for a patient's judgment. If you were driving on the highway and you saw an ambulance behind you with the lights and sirens on, what would you do?
I pull over.
Very good. So that is intact as well. Now, at this point of the assessment, I would check the patient's vital signs. I would do a blood pressure, temperature, check the patient's respiratory rate, as well as the patient's pulse. So moving on after the vital signs, I would inspect the patient's symmetry of his head and his face. So just based on inspection, his head is intact. It's sitting erect on his shoulders. There's no abnormalities, and it's midline as well. It is also in proportion with his body, and his facial features are symmetrical. And next I would check the patient's skull. So lean your head down for me. His skull appears to be intact, no bruising or deformities. It's nice and rounded as well and symmetrical like we said. I'm going to check the patient's scalp by palpating now. There's no nodules, masses, deformities noted. His scalp is clean, shiny, and his hair is noted just on the back of his head around here. Very good. Next, I'm going to check your external eyes. So the patient has a good gaze directly towards me where he's supposed to be looking. Go ahead and close your eyes for me. His eyelids cover his eyes fully. It's smooth, no deformities or masses noted in either eye. His eyelashes are intact. They have equal distribution and they're pointing outwards the way they're supposed to be on the upper and lower. Next, open your eyes. His sclera is white and clear. I'm going to pull it down a little bit here. His conjunctiva is pink, moist, and glistening, which is all excellent. Okay. Next, I'm going to use a Rosenbaum card to check your vision. So hold this about 12 to 14 inches away from you and read the lowest line that you can see with both your eyes.
LTFPH.
Good. Holding the same distance, go ahead and cover one of your eyes and read the same line.
LTFPH.
And the same thing with the other eye, please.
LTFPH.
Excellent. So I would note that the patient has 20/20 vision in his left eye, 20/20 vision in his right eye, and then bilaterally 20/20 vision. Very good. Next, I'm going to use the same card to assess the size of your pupils bilaterally, so look straight ahead. I would say they are both about a 3 millimeter pupil size bilaterally, a round shape, no abnormalities in the pupil shape either. Next. I'm going to check for consensual pupillary response. So a little light in your eye. So his consensual pupillary response is intact in both eyes. So now I'm going to check for pupillary accommodation. Look at my finger and then look at the wall behind me. Good. Same thing. Look at my finger and look to my left. Excellent. So pupillary accommodation is intact bilaterally, and they are both reactive and constrictive as well in both eyes. Good. Now I'm going to use ophthalmoscope to check your red light reflex. And I'm going to use my right eye to check your right eye. So a little light in your eyes, look straight ahead. Excellent. And now my left eye to your left eye. And his red reflex is present in both eyes, so that's very good.
Great.
So now I'm going to check your frontal and maxillary sinuses for any pain or tenderness. So
Sure.
first I'll do your maxillary pain or tenderness.
No.
Good. And then your frontal, any pain or tenderness?
No.
So no pain or tenderness noted in the maxillary or facial lymph nodes, so that's good.
Great.
Next, I'm going to inspect your nose. So the symmetry is intact, it's midline. I'm going to have you do a sniff test to check the patency. So cover one nostril for me and take a deep breath in and out through your nose. Good. Same thing on the other side. Very good. So air is moving in and out evenly, so they are both patent on each nostril. Very good. Now I'm going to inspect the inside of your nose, so look up a little bit. So his mucosa and septum and turbinates is what I'm looking for. They are symmetrical and intact. And you do have nose hairs, which is, normal as well. And they're evenly distributed in both nares. Next, I'm going to check your external ears for any pain or tenderness. Okay. Any pain here at all?
No.
Okay. And here?
No.
Okay, so no pain or tenderness in the tragus, mastoid, or pinna, which is excellent on bilateral ears, so that's good. Now with my otoscope, okay. So I'm going to maintain contact with your head. Look to your right. I'm going to pull his outer ear up and out. Good. And then same thing, look to your left, please. Pulling the ear up and out while maintaining contact with the client's head and positioning the otoscope to the patient's nose. Very good. So I saw the tympanic membrane, which was pearly white and gray. I saw the cone of light in both eyes, and a little bit of sebum and hair, which is normal as well in both ears. Okay, and then next, after that, okay, so we did that, and then next I'm going to do a whisper test on you. So if you don't mind, I want you to cover up your right ear and then look to your right. And I'm going to whisper 3 words that I want you to repeat back to me, okay?
Sure.
So,
Soccer, baseball, tennis.
good. Same thing with your other ear and look to your left. I'm going to say 3 words that I want you to repeat back to me.
T-shirt, pencil, eraser.
Excellent. Good job. So his whisper test is intact for both ears. Now I'm going to use the tongue depressor to check your mouth. Open wide and say ah for me. So his lips are intact, pink, moist, as well as his mucosa. His vulva goes up when he says ah. His hard and soft palates are also intact. And his tonsils are about a +1 bilaterally. And we already said your uvula went up when you said ah, so that's also good.
Yeah.
Good. Your posterior pharynx was also glistening and pink, which is a good sign as well. Okay. Okay. And then after we inspect your mouth, we are going to do your neck. So upon visual inspection, I can see that your neck is intact, symmetrical, no bulges or abnormal pulsations. I'm going to palpate your carotid on your left side first, which is a +2 amplitude with a regular rate and rhythm. And then same thing on your right side, say a +2 with a regular rate and rhythm as well. Okay. So I'm going to use the Belvis stethoscope now to check for bruit. First on your left side. No bruit noted on the left. And same with the right side, no bruit noted on your right carotid either. Now I'm going to palpate your trachea for deviation. Look up for me. So upon palpation, it's nice and smooth, midline with no tracheal deviation noted. After this exam, I'm going to have you go ahead and drink some water so I can check your thyroid. I'm going to position the client's head looking up. Drink a sip of water as I palpate. Okay. And the thyroid is palpable upon swallowing the water. No nodules or masses noted or deformities. So your thyroid appears to be in good shape. After your thyroid, I'm going to check for the tenderness and enlargement of lymph nodes. Okay. So first, I'm going to do the pre-auricular, the post-auricular, the occipital, the tonsillar, submandibular, submental, your superficial cervical, posterior cervical, deep cervical chains, and then the supraclavicular. Did you have any pain or tenderness in any of those?
No, I did not.
Excellent, very good. Now, I'm going to check the patient's upper extremities for peripheral vascular. I'm going to inspect his skin. So his skin is evenly distributed as well as his hair on his hands. His temperature is nice and warm bilaterally, and the color of his skin tone is equal to the rest of his body. I'm going to check your brachial pulses here bilaterally. I would say it is a +2 with a regular rate and rhythm on each side. And now your radial pulses. +2 bilaterally for radial pulses on each side as well, with a regular rate and rhythm. So turn your hands out for me. I'm going to check cap refill. So I'm also noting that his nail beds are about 160-degree angle on all fingers, and his cap refill is less than 3 seconds on all fingers on each side as well. Okay, and then I'll pause the video.